September is National Suicide Prevention Awareness Month, and the Visiting Nurse Service of New York is providing some details on some signs and symptoms that someone you know might be struggling with suicidal thoughts or in danger of taking their own life. So joining us now on studio, our licensed clinical social worker and associate director of VNSNY, which is Visiting Nurse Service of New York Community Mental Health Services, Deidre Diello. We've got member of Visiting Nurse Service of New York Bronx Mobile Team, Crisis Team, I should say, Rosalind Gonzalez, and also another member of the team, Jenny Ng, and we welcome you all to the show, and good to have you.
Thank you.
Thanks for having us down.
So we've heard recently about people who've actually committed suicide more recently in the month of September, so I'm glad that we're actually doing this to actually bring awareness. But when we talk about statistics are pretty much alarming and on the rise these days.
They are. So I don't know if you're aware, but every 11 minutes someone completes a suicide in the United States. It's the second leading cause of death for those ages 10 to 34. It's the fourth largest cause of death for those ages 35 to 54. And for anyone over 55, it's the eighth leading cause of death. So this is an important topic to talk about.
So when we talk about age, who are the ones that are most prone, most susceptible to risk?
Sure. That's a great question. So, traditionally we've always said that older adults, especially older males, are at greatest risk of completing a suicide. And they are. This older people are isolated. They have a lot more physical issues going on. They're dealing with more chronic pain. However, in the recent years, there's been an uptick in completed suicides for children. So we need to be worried about everyone. It crosses all ages and all cultures.
So there's a crisis unit that you guys have, and it goes out and it deals with those in crisis. But walk us through a little bit about the work that you guys do with the crisis unit.
Sure. So Mobile Crisis Team is one of the many programs at VNSNY Community Mental Health Division, and the program is funded by New York City Department of Health and Mental Hygiene. And VNSNY has actually 6 mobile crisis teams in New York City. There are 2 in the Bronx, 2 in Brooklyn, and 2 in Queens. There's a 24-hour hotline that people can call in, and New York City Well will dispatch a mobile crisis team to meet with the person in their home or at a discrete location where we can find out how it can be helpful to you. And if needed, we can provide in-home short-term counseling services, and we can also link the individual to longer-term services in the community as well. If the person is experiencing any emotional crisis or if they're at high risk of suicide, then we will be able to help them develop a safety plan as well as help them connect with emergency care.
And when we find people committing suicide, for most people, sometimes we hear it takes people by surprise. On the other side, you've got people who had certain signs, symptoms, and people just missed it. So what are some of the warning signs? What are some of the things that we could be looking out for with our loved ones and our friends and family so we can kind of like pinpoint if they're in that unhealthy state?
Yeah. So there are verbal and nonverbal warning signs. A person can say, I want to die, or my life is just not worth living, or I can't deal with my life right now, or I just give up. One of the number one indicator for suicide is hopelessness. Also isolating. A person may stop going to church or stop going to their community center or stop attending family or social events or stop answering the telephone. Or also a person may start drinking alcohol more frequently, and they're usually a social drinker, and now they're drinking alone or using drugs. Or also a person may, their eating or sleeping behaviors may change. They may be sleeping too much or just not able to even get out of bed to go to their appointments. Or also not eating.
Right.
Or overeating. And also risky behaviors like maybe walking into traffic or leaning over a subway platform edge or driving recklessly or under the influence. So these are signs that we should all look for.
Yeah, and I want to ask about common threads, right? Because nowadays, people are committing suicide and you're asking the question, what was it? What is it? Are there some common threads that we should be also laying hold to say, listen, this is something that we have to pay extra close attention to given the times?
I think you need to listen to what the person's saying. If the person's talking about being in pain or not doing well, it's just listening with an open ear. And more importantly, ask the question. If you're worried about somebody, you need to ask. Don't be afraid to ask. No one's going to take their life because I asked you, do you think that you want to kill yourself? we need to be asking, this is a public health crisis, and we need to all be discussing it openly.
Education awareness has always been, you know, the platform that you guys want to bring, but you know, in the community sometimes it's taboo. Don't want to talk about it, don't want to deal with it, right? So instead of us coming to you, I know September you're taking it to us and helping us to understand, but share a little bit more about what you guys are doing to take the message out and really bring awareness to New Yorkers about this, you know, very serious issue.
Sure. So we are taking advantage of the fact that September is Suicide Prevention Awareness Month, and we've partnered with NYCHA, New York City Housing Authority, and we are doing suicide presentations in senior centers. And also internally with our own agency, we are starting the dialogue. We want everyone to start talking about suicide. It's not an individual act. Somebody completes a suicide, but it affects all of us. So we want everyone in our agency, from the frontline staff to our call center staff and people who work in the office, to be comfortable talking about this with people.
Jenny, do you find people, I mean, are you dispatched out a lot?
Yes, I mean, we see a lot of our individuals in the community that are at risk. A lot of them suffer from depression or other mental health issues, and I think, you know, it's really great that, you know, most of these individuals allow us into their home and meet with them and just connect them with services and provide this ongoing support that they much needed.
All right. We want to thank you guys for coming and sharing, and certainly want to bring you back hopefully before the end of the month, share a little bit more, because this is very important. As you know, it's affecting a lot of people, not just nationally, but worldwide, as we find it out. Even in the world, suicide rates are continuing to rise. So very important topic of discussion. Thank you all for coming and sharing with us.
Thank you for having us.
Thank you.
Alrighty, listen, now if you want to learn more about community mental health services at the Visiting Nurse Service of New York, you can visit VNSNY.org. Once again, VNSNY.org. Or you can call 1-888-867-8418. That number again, 1-888-867-8418. Now, if you do know someone or you have someone that's experiencing any emotional issues, you can also call NYC Well. Now that's a 24-hour, 7-day-a-week support hotline number, and that number is 888-692-9355. Once again, that 24-hour number, 888-692-9355. Please do not be afraid to make the necessary call. Got to take a quick break. We'll be back with more Open right after this.